Yeah, I would also go back to that fact-based hope that we talked about before, because at the initial diagnosis, when you're explaining the disease, I think it's really helpful to be realistic, as you said, and be clear about what's really going on. But because research has accelerated so fast in the last few years, and someone's going to go home and Google myelofibrosis and say, oh my gosh, I have a year and a half to live, or I have 3 to 5 years at the most, or I might progress to an acute leukemia, because they're going to see those things. I think part of that initial conversation is really helpful to have, to offer a sense of how much we're learning and how things are changing so quickly, and that there is hope, and that someone like me, who 5 years ago might have been told they had a life expectancy of 18 months, that was only on paper, given my risk factors, but that changed. That changed dramatically.
Yep. I think you hit on something that's really important that it took me some time to appreciate, is the concept of median survival. So we often will tell patients, will ask us, well, how do you stage myelofibrosis? Because that's what people understand. I have stage 1 breast cancer, stage 3, I have metastatic disease. And of course, myelofibrosis is not staged that way. It's essentially metastatic at diagnosis because it's throughout the blood and bone marrow. But we risk stratify patients, and we put patients into risk groups. And many of the patients are sort of aware of what their mutation is, what their risk score is. But what I do worry about, and I try to address right away, because patients will go home and Google things, and they'll see like that median survival of that risk group. And I try to explain to patients that that's looking at groups of patients, and it does not inform that individual what their course is going to be like, because that can be terrifying if you're sitting alone in your bed at night after this visit with a physician and you're trying to research this stuff and you're reading it but not totally understanding the context of it and how it applies to you. That can be very frightening. So I try my best to urge patients not to do that kind of research, because I do think it really can get patients into a dark space, but also to realize that a lot of what you read doesn't really pertain specifically to you. And it's usually groups of patients and doesn't really inform the patient specifically what their life is going to look like.
Right. And the way it was explained to me as well in the beginning is that a lot of these studies are older, before the drugs were available that we have now. And a lot of the patients were sicker who went into these studies. And all of that means that they don't necessarily look like me. And that's really helpful
Absolutely.
to be told.